my name is Nicholas Luthi. I am the Chief Product Officer at Colette Health. We began our journey interested in video communication within the hospital. And that started as a journey with patients sitting in safety, looking to solve falls, suicidal ideation, and some other safety-related use cases. And more recently, that has evolved really into a story of virtual nursing and caring for the patient regardless of walls and regardless of boundaries. And visual communication has always been very important to us. We always believed that conversations and communication happen not just with words, but also with what you see, you perceive, the tones and the tonality. And so two-way video was and has been very critical for us.
I'm Alex Lindsay. I'm the Director of Engineering here at Colette Health. We use the video API on our platform in over 170 hospitals in the United States, and we've completed over 15 million plus hours of patient observation on video. And we've impacted over 50,000 patients along that journey. And one of the main benefits of using our platform is a lot of cost savings to hospitals. We've accounted for more than $3.5 billion in cost savings, as well as preventing patient falls, which each patient fall extends a patient's time in the hospital, costs the patient and the hospital money. And we prevent annually over 100,000 falls.
Video offers us, just conceptually, this whole breadth of dynamicism to communication. It's the visual, it's the auditory, it's the tone, it's just the demeanor. You can build relationships, if you will, over long durations of time. And sitting, an observer might be watching or caring for a patient for hours and hours at a time. And you start to build this rapport together, which when the moment in time comes that you need to provide verbal redirection or instruction or comfort and assurance, that becomes all that much more poignant. I think in virtual nursing, that personal experience, that bedside care is really only effective through video. And to be able to bring that level of communication into the patient's room with the right resource, so whether that's a nurse or a physician specialist, an interpreter, when we are in the virtual nursing conversation, being able to bring the right resource in to provide the right care at the right time, regardless of where people are located, is really powerful to me. One of my favorite use cases, and there's two use cases that video really enable that really excite me in virtual nursing. They may not be the most predominant or the most discussed, but I think that bringing a family member in to participate in care. And we hear about this potentially in the pediatric case, where if you've got a very young child that is receiving extended care, and you have a parent that has duties and obligations in life. They're working, or they've got errands to run, or they have to go take care of another child at home. That feeling and sense that you might be abandoning the patient, right? That child of yours in the hospital is such a terrifying moment, I think. And to be able to have the moment of comfort to say, well, I can check in, I can communicate, we can have a conversation, I can still be virtually present. And the second use case I think that is really cool, that again is maybe not the mainstay of virtual nursing, but is the remote chaplaincy. To be able to bring in a spiritual guidance or counselor, to be able to bring someone in that can provide care for the person in a spiritual aspect, not just in a physical, mental, or emotional aspect, but you can provide really a holistic sense of care when you think about how virtual nursing can evolve to truly care for the patient as a whole person. When we're thinking about virtual safety, and for our platform, one of our fundamental components that we believe in profusely is that video is persistent. It's always on, it's engaged, right? If you are waiting to react to a fall to bring someone in, then you might be really more documenting and observing something that has happened in the past tense. What we're really about is using video to be proactive in our engagement, to be proactive in our patient care, to be proactive in our nursing. And when you're looking at a fall, moments matter. So to be able to have a remote observer that's consistently watching multiple patients and to be able to engage and provide verbal redirection at a moment's notice, it's very powerful, very poignant, and the outcomes show that it's a better way to go.